Next up is Dr. Alexandra Murphy from the University of Michigan.
All right, good afternoon. This is gonna be a very different kind of talk than you just heard. So I'm gonna talk to you a little bit today about the creation of the Transportation Security Index, particularly a 3-item one. And to get started, I wanna begin by sort of having an interactive minute and asking you a series of questions. So I wanna ask you, in the past 30 days, how many of you would say that you have had to arrive someplace early and wait because of the schedule of the bus, train, or person giving you a ride? Just as a raise of hands. Some of you have had to. The airplane? No, the airplane doesn't count. In the past 30 days, how often were you not able to leave the house when you wanted to because of a problem with transportation? Who would answer affirmatively? One of you. And how many of you would say that in the past 30 days, did you worry about inconveniencing your friends, family, or neighbors because you needed help with transportation? A couple of you. Okay, some of you. So based on a lot of qualitative research into the lives of low-income families in urban, suburban, and rural areas in the US, my research team and I have come to learn that these are just some of the symptoms of a condition that we call transportation insecurity, which we define as a condition in which a person is unable to regularly get from place to place in a safe or timely manner because they don't have resources for transportation. And we think about resources broadly. They can be money for gas, money for a bus ride, you may not have friends with cars, you may not have the physical health to walk. And it's a condition that has really dire consequences, right? It can make it difficult to go to work, to keep your job, to go to school, to access social services, to go to the grocery store, do things necessary for daily living. And one of the things, even though that this is sort of a very dire condition for people who experience it, it's something that really hasn't been researched a whole lot. And one of the reasons that my research team and I hypothesized is the reason for this is because we didn't really have a good way to measure this condition. So when you look at the metrics that people often use to measure whether people can get around, there's sort of a series of proxy measures. So sometimes people look at mode of transit, whether you have a car or use public transit. People look at travel behavior, so commute time. People use activity-based models. There's measures of neighborhood accessibility, right? How walkable is your neighborhood, or how many jobs can you get to from the place where you live? And then sometimes people use the 5 A's of access, so affordability, availability, accessibility, accommodation, and acceptability. And while those can sometimes tap into transportation insecurity, they aren't always able to sort of be direct correlations. So if you use things like car ownership measures, those miss people who have cars but who can't use them, right? Or they can't pay for gas, or they can't pay for repairs. Lots of these proxy measures miss people who live in accessible neighborhoods who can't get around. Being able to access transit or living close to transit doesn't mean you use it. None of these measures can really pick up unmet travel demand, right? Whether you have more places you want to go that you can't. And then one of the things that we saw a lot with people who are low income is that people use their social networks to get around, and none of the measures that were currently available to people could pick that up. And then if you look at the literature, there's a lot of sort of different measures that are used inconsistently, which makes it really difficult to draw conclusions and make comparisons across studies. So why does this matter? For us, we thought this mattered for a number of reasons. It's without a measure of transportation security or insecurity, it's really hard to understand how many people experience this in the US and who does, how it's changing over time with things like the rollout of autonomous vehicles or alongside changes in insurance prices or the cost of cars. It's hard to understand what causes transportation insecurity and what the consequences are for people's well-being. It's hard just to measure whether our current transportation system is meeting people's needs, right? And then it can be hard to evaluate whether policies and our investments in transportation is effectively moving people from insecurity to security. So for that reason, my team and I have been working on creating what we call the Transportation Security Index, which is a validated individual level measure that's explicitly designed to capture transportation insecurity as it's experienced qualitatively by people, regardless of where they live or what mode of transit they use. And so using this index in original survey data, we've begun to answer some of the questions I had just laid out. So we did an original survey in 2022, we found that 1 in 5 adults in the US experience transportation insecurity. When you look at different subgroups, you see that over 50% of people who live in below the federal poverty line do, so that's a very high rate. We find that transportation insecurity is more common than other kinds of material hardships that low-income families tend to experience, like food insecurity, housing insecurity, having your utilities shut off. We've looked at transportation insecurity by location and found some interesting patterns that are kind of surprising, with urban residents being most likely to experience it, and then suburban and then rural residents. So with that, what I want to do is I want to tell you a little bit about a brief overview of how we developed our original. So this talk is supposed to be about the 3-item insecurity index, but I want to talk to you about how we have developed the first original index, so that you can understand sort of what this measure is designed to do and how we went about doing it. And then I want to talk about how we abbreviated this index, and then really get into some use cases. So for us, in thinking about how to create this, when we decided on this project, our aim was really to create a measure that would be able to, 1, detect the presence of transportation insecurity at the individual level, and 2, be used as an independent and a dependent variable in causal inference frameworks to look at the causes and the consequences of transportation insecurity. And so that aim meant that there were sort of 2 implications for what this measure could look like. The first was that the measure had to be mode agnostic, right? Which would enable users to examine how a wide variety of modes, whether it's cars or buses, or other inputs like gas prices, would shape insecurity. The other thing the measure had to do is it had to be destination agnostic. So none of the questions could have questions that asked you if you went to the doctor or if you missed work or things like that. So we could look at whether if you are transportation insecure, it bars you from getting to those places, and whether that then has consequences for things like employment or your health. So having determined that, in going about and figuring out how to put this index together, transportation insecurity is a latent construct. It's a latent construct like depression or consumer confidence or food insecurity, which means that it's theoretical and multidimensional that can't really be directly observed, right? It's very hard to measure things like depression, so people ask you a series of questions. And so when you are trying to measure these things, they're often assessed through or you can think about it as a diagnosis, through multiple correlated observable indicators that are shaped by the underlying construct. And so I have on this far left image the food security index, which is something that's very hard to measure except when you ask people about the symptoms that they're experiencing. And I think it's important to indicate that on their own, none of the questions in, let's say, like the depression scale or consumer confidence can measure this latent construct, right? So if you ask people a question in the food security index, like how often have you skipped a meal, that can't tell you by itself whether someone's food insecure. But when you take all of the 6 or 18 questions together, it can measure this underlying latent construct. So we knew that given that transportation insecurity is a latent construct, we were gonna need a series of questions or symptoms that were gonna tap into the multiple ways that transportation insecurity symptoms manifest in people's daily lives. So just to give you a super brief background on sort of how we approach this, in trying to think about the symptoms, what we did is we took qualitative data. We had over 3 years of ethnographic observations of low-income families. We had 187 interviews with people, and we used this qualitative data to look at how transportation insecurity manifests. And we identified that there's sort of 3 manifestations. One is material, so like things like skipping, not being able to go to a destination or being late. We saw that there were relational symptoms, so things like people worrying about inconveniencing their friends or families for rides. And then there was emotional dimensions, people feeling bad, people feeling embarrassed that they didn't have the transportation they needed. So we identified all of these symptoms, and we developed then 23 candidate items from that could tap into this condition. We then went about and conducted 52 cognitive interviews. These are ways that survey researchers look at whether their questions are being understood by people who are taking the question, and whether when they're responding, they're actually responding in a way that makes sense given their situation. And after those cognitive interviews, we refined our items. We found that some were burdensome, so we got rid of them. We found that all of our questions originally kind of looked like the food insecurity questions that asked people if their problems with transportation were tied to problems of affordability. But we found through these cognitive interviews that when we would say, like, did you arrive someplace late because of problems, or did you skip a trip because of you couldn't afford different transportation, people would say they would say no, and then you'd start interviewing them about it, and they'd say, it's not because I couldn't afford it, it's because the bus didn't show up, or my friend, had to take a second shift and so couldn't pick me up. And so we realized that for people, they think about their transportation not always as tied to what they can afford or not. And so we got rid of any mention of cost in our questions. After we had done these interviews and we had our questions, we did an original survey, and we did exploratory factor analysis. And what that came up with is it indicated that there was a 16-item transportation security index, which we then did another survey to validate that, which we were able to do on a nationally representative survey. And we found that this 6-item index could identify 5 categories of insecurity. So sort of briefly, this is the original Transportation Security Index with 16 questions. You can administer it on a survey. What you do with it is you sum the scores of each question or each symptom to assess an individual's experience with transportation insecurity. And what people can do with this is identify these 5 different types of insecurity, right? So you can use this measure to see whether there are people with no insecurity, whether there are people with marginal insecurity, people who have low insecurity, moderate insecurity, and then high insecurity. And so people who are in that sort of highest category have a really, really hard time getting around. People in the sort of the middle range sometimes have constrained travel or intermittent ability to get around, but they're not really stuck in place like in this high category. So that may sound all well and good, but one challenge is that 16 questions is a lot of questions. No one has the patience to sit and answer those, and it's really expensive from a survey perspective to ask 16. So a few years ago, we went about to try and develop a shorter and abbreviated index and to validate that. And what we were able to do is identify a 6-item index. And we did this by using graded response models and content analysis to look at the content of our 16 questions. So we sort of used the original index to see if we could shorten that. And we were able to come up with a 6-item index, which we then validated on a nationally representative sample using a split ballot experiment where we had basically the 16-item question administered to one group of people and the 6-item and the other. And then we looked at how the measure was comparing on a number of dimensions across these 2 surveys. And what we found was that the 6-item was validated and did very well in preserving the psychometric properties of the original and classifying people similarly. So that might sound good, but there's still a challenge, which is that for many users, 6 items is still too many. It's still can be too expensive to add on a survey and could be too costly. A second challenge is so we recognize that some people would think 6 items is too long. And if they deemed it too long, what we were worried about is that users would sort of pick and choose a couple of subset of questions and put them on their survey and say, hey, we're measuring transportation insecurity, but we don't know if their questions actually are measuring that latent construct, right? And so what we wanted to do is challenge ourselves to see if we could come up with an even shorter version of the TSI. And in doing so, we wanted to see if we could shorten it to 3 items. And 3 items is really the smallest number of questions that you need to measure a latent construct. So what we did to do this is we followed basically a very, very similar methodology as we had done to identify our 6. So we used both statistical approaches and sort of qualitative content approaches to analyze each of the questions. We used the 6-item index as our sort of gold standard to see if we could find 3 in there that would work just as well as the 6-item. We used a graded response model to evaluate the item characteristics. We found that a question about whether people were rescheduling appointments was the least discriminating, which means it's very hard to differentiate between people in those different categories of insecurity. And because to reschedule appointment meant you had to have one, we decided to take that question out of the index for consideration. We then found that questions about inconveniencing your friends and your family and questions about whether you had problems with transportation affected your relationships, those 2 we found had low item discrimination, and they also overlap semantically. But we also found that relationship effects was the most difficult item to endorse. And the more, the more you eliminate items or you have a smaller number in a survey, you really, really want to make sure that you're picking up on the people who are experiencing the condition. So we wanted to keep the question about whether people had problems, relationship effects because of problems with transportation in our model. So we eliminated inconvenience, and so this left us with 4 questions from the 6. We arranged all of our four questions into sort of 3 different 3-item questions that you could do. Each of them had relationship effects because, again, that showed that it was the most difficult to endorse of our 6, and we wanted to keep it. And what we found is we then looked at how they worked next side by side, whether they were identifying the same people as transportation insecure and predicting the same number of people as in terms of prevalence of insecurity. And we found that they did. So sort of our quantitative analysis didn't suggest which one to drop or which one to use. And so then what we did is we turned to a bunch of content experts. We reached out to transportation officials, people who work in social services, doctors, and we asked them, we wanted this index to have face validity. And again, the fewer items you have, the harder it is to have face validity because you're just staring at 3 questions, which gives you a lot less context for sort of tapping into this. And we asked for people's feedback about which of these 3 options they would choose if they could only choose one and why. And while we found that there was support for all of them, it was option 2 that people were drawn to the most, partly because they liked the idea that this one had 2 material symptoms, right? So it asked about people skipping trips and being not able to leave the house. And people also worried that, in option 1 and option 3, we had this question about, do you feel bad because of problems with transportation? And people worried that without the other context of the other questions, feel bad might feel stigmatizing, and people may not want to admit to those feelings. So we chose this option 2 as our 3-item, and then we validated it. We sought to validate it on an original nationally representative survey, again doing a split ballot experiment where we compared the 6-item performance to the 3-item to see if they preserved the same psychometric properties and were picking up the same people as insecure. We also looked at the predictive validity of these 2 indices to see whether they were equally predictive in predicting mental health outcomes and physical health outcomes, and we found that they did. And so we successfully validated the 3-item index. In the end, just to put sort of all of the versions of the index up on one screen, you can see here the 16, the 6, and the 3-item, and what questions are in both. In terms of comparing them, we found that each of these versions of the index performs similarly, and they're able to identify individuals experiencing transportation insecurity and the prevalence estimates they generate. The biggest difference, if you're interested in using this, is in the categories that they identify and the time to completion. So whereas the 16-item index can identify 5 categories of insecurity, the 6 can only identify 3, and the 3 that we just developed can only identify 2. So it can only differentiate between whether someone's insecure or secure. And again, here, time to completion, we basically went from 2 minutes to 1 minute to 30 seconds. So it's much easier, the 3-item, much easier to administer than the other 6 or the 16. Okay, so I want to close out just by talking about a couple different use cases that we're seeing, both potential and ones where people have applied this in the real world, the index. One use case for those who are researchers is just basic research into how transportation insecurity impacts outcomes of interest relevant to well-being of families and communities. You can also look at the financial costs of these outcomes and really think about what the costs of transportation insecurity are to stakeholders and what we're saving when we solve transportation insecurity in terms of ROI. Looking at research, the TSI has been included in studies that examine the association of transportation insecurity with employment and earnings, experiences with material hardships, and studies on education. One of the things we've found is that people in the health field are really interested in using the index to understand insecurity and things like people's visits to the ER, people's ability to pick up their prescriptions, and other kinds of health outcomes, including I think one of them is colonoscopy visits, people who have dialysis treatments. There's been a bunch of people who have used the TSI in this way because dialysis requires a lot of trips across the week. In terms of what people have been finding, just to give you a preview, in work that we've done, we looked at transportation insecurity's association with poor physical and mental health, and we found that transportation insecure people are more likely to report poor health than transportation secure people. They're also more likely to report having depressive symptoms than transportation insecure people. And while that may not be surprising, one of the things that we were surprised at was really the magnitude of these associations. So we found that transportation insecurity is just as strongly as associated with these health outcomes as not having sufficient food to eat and having unmet medical needs, which is pretty strong. We've also got a paper we're working on that looks at transportation insecurity and its associations with employment and earnings. And what we found is that maybe not unsurprisingly, transportation insecure people are less likely to be employed than people who are transportation secure. Transportation insecurity is also associated with lower levels of weeks worked in the last year, hours worked in the last week, and earnings in the past month. And again, here too, when we think about sort of how to contextualize those findings, we looked at, we compared the magnitude of our associations with those with people who had less than a high school degree, because we know that having less than a high school degree is highly associated with these kinds of outcomes. And we found that the association was just as strong between transportation insecurity and these outcomes as having less than a high school degree. So I think it speaks highly to just how much this matters. A second use case is that researchers or states and POs can use it and are using it to document the prevalence of transportation insecurity and monitor it over time and alongside transportation investments. So people have started using the TSI on regional and statewide surveys, including the state of Michigan has done this, to really look at whether and try to sort of quantify whether the transportation system is meeting people's needs. So you see that people have established baseline prevalence estimates. The state of Minnesota has used it on 2 reoccurring surveys, so they're monitoring over time. In the city of Baltimore, they've used it on a survey that's been conducted 3 years in a row and have sort of been able to see how transportation insecurity has gone up and down over those 3 years. So that is one use case that we're seeing. Another use case is to be used in the evaluation of the efficacy of individual investments or programs on individual participants. So the TSI is being used in pre and post causal frameworks to evaluate whether transportation pilots, so I see Jean Rusteman here, mobility wallets in the state of Michigan. There's been studies of e-bike vouchers in Raleigh and Washington, D.C. So people have used it to look at, what are participants' transportation insecurity levels before they participate in these programs, and then what are their transportation insecurity levels afterwards to see if these interventions are having an effect on moving people to security. And another example of this is the FTA has a program called the Mobility, Accessibility, and Transportation Insecurity Creating Links to Opportunity Program, and the TSI is being used in that way to evaluate that demonstration program. Another way that the TSI is being used is to screen individuals to determine eligibility. And I will wrap it up. Another way it could be used is to look at hotspots. Thank you, Debbie. Happy to answer questions.